This is Style Club Radio with Josh DeMarco, Steve LaSanchez, and Michelle Miller.
All right, everybody. Don't forget to follow us at Style Club Radio on Instagram and YouTube. We're going to have some great behind-the-scenes action.
And we are back with Cheryl George, the creator and co-owner of Deme. And if you don't know what Deme is, Cheryl's going to tell you again with some of the amazing procedures you're doing. Before Cheryl tells you that, it is funny because when you think about cosmetics, and I know people that go, I would never get Botox, I would never get injections, but...
I'm so offended.
But you said something that really kind of sunk in with me when you're like, everybody has probably something that they're self-conscious about, something as simple as a smile. Like myself, I have implants. I have 2 implants and not wearing a retainer afterwards. My one tooth has went back a little. Mm-hmm. So sometimes I'm self-conscious to smile, and it's like, it's just so smart what you're doing. It really is. Like, from this up, I'm pointing to my neck, everybody. from
We're on the radio.
Right. I mean, whether you think you're, I don't need that, but you probably do. I mean, it really is it's so important how your mouth can make you feel better, more confident, or just have...
And healthier.
Yeah, and definitely healthier. Mm-hmm. So, that was just my little side note, my little shoulder bump to you. So, tell us more.
Well, everybody, really when I meet someone or they meet my husband and me at a, social function, they know I'm a hygienist. I don't really practice anymore, but I know a lot about teeth and gums. And they'll inevitably, after a couple of drinks, they'll start to retract their cheeks and show you. And inevitably, they have recession, and they don't understand why. But the gum is higher up; it's above the crown of the tooth, and it just doesn't look good. And it's a lot of times it's from toothbrush abrasion. So I'll just teach them how to brush their teeth at a cocktail party. But
no big deal.
But about maybe 5 years ago, my husband took a course with a California dentist, and his name is Dr. Chow. Genius. He created this type of surgery where it would bring the tissue that was receded back down to where it belongs without any cutting. It's called PST, pinhole procedure. And so when my husband took this course, and he said to me, "This is really groundbreaking," and I said, "I think it's BS." I was looking at it, I was like, "You got to be kidding me! I'm a hygienist for 30 years. You can't tell me that." And so we go to California, and long story short, it's the most amazing procedure for gum recession. That is, it doesn't take gum from the palate, the traditional gum grafting, when they take the gum from the palate and put it in the area. It doesn't do that. So you're not creating 2 wounds. You don't take any skin. The analogy would be like pulling up a sock. Up the leg, and so you're bringing that gum up to where it belongs. And it is to me, in all of my years, I did research at Penn Dental School for 10 years, but in all my research and all my years of clinical practice, this is the most impressive surgery I've seen to date. Wow. And patients that have it, they literally will hug my husband at the post-op when they come back a week later. They just are so happy. Wow. And, women then want to buy all the lipstick. So they'll go to my makeup artist, Robbie, and say, "Choose some lipsticks. I haven't smiled in years." So it's really, really nice to do that. And, and everybody's doing Zoom teeth whitening and this and that. We do whitening. But that's a beautiful improvement, but that's very typical. But it's to have a clinician to do the PST. There aren't that many of them in Philadelphia, and so he does hundreds of them.
Wow.
So that to me is a beautiful
Now, is that
surgery.
pure aesthetic, or is there actually health benefits?
No, definitely health benefits, because when you lose coverage at the root of the tooth is not designed to be exposed to the elements of food and air. So they're sensitive. They can decay quicker because on a molecular level, the root of the tooth isn't bonded as tightly as the crown of the tooth that you see when you smile. So you get more susceptible to decay. And you start getting decay on the roots, you have some problems. Yeah. It ain't pretty.
So what is that caused by when you have gum recession?
What's it caused by? There are a couple different reasons. It depends on the patient. One of them is a physical brushing away of the gum.
Okay.
I love Sonicare toothbrush. It's probably the best.
Oh, I just got one.
brush.
Oh, we
Love it. Love it. Love it. Love it. I haven't used a manual brush in like 35 years.
We have a family member, and I'm not going to say who the family member is.
Are you pointing at him?
No.
Okay.
But their toothbrush
Sonicare.
looks like a palm tree in a hurricane.
Oh, nice.
It's just like splayed out.
Really
and, like,
effective. Yeah.
Oh, and I would say that they probably would need to check their gums.
I don't think
Like,
he has gums anymore.
I don't think there are gums. Yeah, I think if you just, I'm horrified every time I accidentally see their toothbrush. I'm like, oh my gosh, it's so aggressive.
Because I've always had like problems with my gums receding.
Who doesn't?
But my dentist in the past would tell me it's because I'm a mouth breather. But I didn't know. Is that true?
Oh, you mouth breather.
No, I'm like,
Yeah.
You know, when I sleep, I'm like with my mouth open.
No, usually a mouth breather, the gum tissue would be pink and red.
Okay.
But I could be wrong. I'm hardly ever wrong, but I could be wrong on that.
Spoken like a true wife.
Yeah.
I'm hardly ever wrong.
Yeah, I guess you're obviously married and heard that. But no, all kidding aside, I've never seen someone in my clinical years of practice that had gum recession from mouth breathing. It just the tissue looks so pink and irritated. But there are some genetic factors with that, and also some occlusal issues, the way your jaws hit each other. Some occlusion can cause some certain recession issues, and that's diagnosed when you come in and say the dentist, like my husband would say, I think it's this contributing. But no matter what's contributing, that can be corrected.
Oh, I love that.
I like that too.
Yeah.
Because for years I was like, oh, I'm a mouth breather. That's why it keeps happening. And I've had my teeth in like twice.
Yeah. But
Oh my gosh.
most recession can be corrected. Yeah.
Oh, all right.
Yeah.
Well, I'm going to come see you guys.
I mean,
Yeah.
that
Come
does
see your
sound
husband.
amazing. I mean, you guys offer so much from teeth cleaning to
Yep.
Like all the normal dentist stuff, you guys.
Yep.
We do all the normal dental stuff, and then we do then some. We have a computerized one-visit crown. It's called CEREC. So it used to be back in the day, you'd come in, you get a temporary, and then you come back 2 weeks later. It's all done. It's computer generated. The dentist preps the tooth as he or she would normally prep it, and then there's this computer wand, and it takes all of the measurements, and then it sends it to the signal to the milling lab,
Yep.
and it just mills the crown. An hour and a half later, you walk out with your permanent crown.
Oh my gosh.
Yeah, it's
that
fun.
is
And people like to
crazy.
go in the lab and watch their crown being fabricated, so it's kind of entertaining for 20 minutes.
Oh, my gosh.
So
I have
we
to wrap
got
this
to
up.
wrap up. We're running out of time. But Cheryl, I got to say, you guys are like the black magic of dentistry. Everything you've just said, I'm like, I've waited weeks for crowns. My gums. I have so much dental work. I will 100% be a client of yours.
I wish we had
Thank
another
you, Lord.
segment.
Right? I know.
I know. We could just keep on talking.
We could keep talking,
Yeah.
but we can't keep talking because
We're not allowed.
Steve is a big, large breather.
Mouth breather.
Stop breathing.
Does mean that if you want to know more, you can absolutely find them on Instagram or at their website, Deme PHL on Instagram. And certainly book your appointment or consultation, right? I mean,
Yeah.
that's step one.
It's great. We'd love to see you.
DEME, by the way, Cheryl, it's been great.
Thank you.
I wish we could talk to you longer. Maybe
Thank
we'll
you
come
so
back in
much.
a couple weeks.
Yes, please. Thank you.
Thank you, Robbie Nelson and Cheryl George from Deme. You guys are great. World of knowledge. Everyone else for listening.